Good morning, everyone. Thanks for joining us. This is our 90th briefing on COVID-19 since the beginning of the pandemic in March of 2020. Also, the final time we'll get together before the end of the new year. We will not have a briefing from me next week, but we'll be back with you the first week of 2022. But for all of those who are watching and joining us this afternoon and later, as you might watch it later in the day, wishing you a very merry and happy Christmas and a healthier and prosperous new year. Let's jump right into our data points. We are currently monitoring 1,754 active cases. These are individuals who have tested positive, with 72 individuals hospitalized. On the same day last year, we were monitoring 1,511 active cases with 103 hospitalizations. A couple things to provide a bit of context. Right, a year ago, we were still in much higher degree of isolation. If you remember, certainly holiday celebrations a lot smaller. Certainly, we didn't have big community events like we saw this year. And in many cases, schools were still in a remote setting. So a little more, interaction. The positive take from this is the negative is there's more positive cases. The positive take is while we are seeing a higher degree of transmissibility, while hospitalizations are certainly climbing, the level of severity is not as steep as it was a year ago. It's still something that we obviously have concern about and want to continue to monitor, and we are, and we're working with our healthcare providers and others countywide to be able to monitor both positive cases and respond as appropriate. We will continue to encourage that you take those mitigation steps, and yes, those mitigation steps include choosing to be vaccinated, wearing a mask, not engaging in those large social activities, physical activities. Certainly, if you're not feeling well, staying in. The goal here is just to protect your health and the health of the people around you. We encourage you to do those things. Just as a reference, active cases are 16% higher today than they were a year ago, with hospitalizations, as I said, being 30% lower than they were a year ago. Over the last month, from November 21st to December 18th, the largest number of new cases are in the age group between 30 and 39 years of age. That represents 16% of new cases, and that has been relatively consistent over the last few weeks. Now, at 15% of new cases, 15% of new cases, those are occurring in the 20 to 29 years of age category. And then of those who self-report to our contact tracers, 70% of new cases are among those who have not yet been fully vaccinated. We are averaging 196 new cases daily over the last 7 days. I will point to a couple things. We've had a couple highs, certainly in daily cases. We also did see a bit of a decline over the weekend. That's not a sustained thing. That was a one-time data point that obviously gets included in that 7-day average. But 196 new cases identified daily. That's our 7-day average, with the 7-day rolling positivity rate of 7.26%. Sadly, 526 individuals have lost their life to this virus. We are sorry for that, and certainly extend our prayers and thoughts to those who have had to experience this heartbreaking loss. And over the last 7 days, we are averaging 2,679 tests administered daily. We are getting a lot of questions. I'll talk a little bit about access to testing. We do have opportunities for access. There is a scarcity of access, certainly nationwide and throughout the state of New York, but we have been administering a large number of tests at our public free testing clinic at the former JCPenney's location in Poughkeepsie. And then, of course, there are those of you who choose and have access to healthcare provider for testing. 2,679 tests have been administered daily, each as an average over these last 7 days. We've administered 1.1 million COVID-19 tests since the start of the pandemic. And just as a reference, we have administered 51,000 tests in Dutchess County in the month of December alone. So 51,000 tests conducted in Dutchess over the last several weeks in the month of December. Vaccinations continue to climb at 82.5% of 18-year-olds, so nearly 83% of all adults have chosen to receive their first dose or at least begin their series of vaccination. 73.16% of our total population has received at least one dose of the vaccine, with the highest vaccination rates among those who are 55 years of age and older, and they range at 90 to 99% vaccination rates among those older than 55 years of age, which does speak to also the categories of new positive tests and the fact that we are seeing new positives among the younger of the adult population. But that said, 5 to 11-year-olds have a vaccination rate of 22.4%. That is just below the state average of 25%. And those 12 to 17 years of age have a 64.3% vaccination rate. We continue to administer our vaccine clinics. We do encourage you to get questions to your answers, speak to your medical professional, and choose to be vaccinated. Vaccinations are available at the JCPenney's location at the Poughkeepsie Galleria. And this Thursday and next Thursday, they're administering the Johnson & Johnson and Pfizer doses. We do encourage you to pre-register. I'll give you that website in a moment, but we do accept walk-ins. We are administering all the dose regimens, so if you need a first, second, or booster shot, those are available to you. Again, this Thursday and next Thursday, 4 to 7 p.m., and they'll be administering the Pfizer and Johnson & Johnson doses. We administered in the county government principally Moderna, just as a reference, over the course of the last 10, 12 months. Well, I guess almost 12 months, 10 months. Oh, no, it's been a full year, hasn't it? It's been 12 months. We've administered principally the Moderna by the county health department, but there are obviously many who have received the Pfizer shot. So Thursday and Thursday this week and next week, 4 to 7 p.m., Johnson & Johnson and Pfizer doses are available, and you can pre-register at duchessny.gov/COVID vaccine, duchessny.gov/COVID vaccine. We encourage you to pre-register. It makes it easier to get through the logistics and, of course, for us to plan for the numbers that we have to thaw and have available. This county does provide free testing, and we do that in partnership with ProPhase Labs. It's no-cost testing that occurs at the JCPenney's location, the former JCPenney's at the Poughkeepsie Galleria. We've moved the testing to the second floor, so you will enter at the Best Buy entrance, or near the Best Buy entrance at the former JCPenney's. That's the second floor at the Poughkeepsie Galleria. And so let me go through that testing and then talk a little bit about what we've been doing. So for this week and next week, the week of Christmas and the week of New Year, we are there Tuesday, Wednesday, and Thursday. So if you're watching today, Tuesday, the 21st, we are there today, Wednesday, Thursday, and again Tuesday, Wednesday, Thursday of the week of New Year's Eve, New Year's Day, from 3 to 7 p.m. We will not be open on Sunday, December 25th, Christmas, or Sunday. I said Sunday. We will not be open Saturday, December 25th, thanks, Christmas Day, or Saturday, January 1st, New Year's Day. Instead, Tuesday, Wednesday, Thursday, 3 to 7 p.m. Now, this testing has been very important to us, very extensive, and we are administering thousands upon thousands of tests, 50,000 plus this last month. That testing opportunity is not available in every county. We've been focusing on this as a means of providing surveillance and data that helps people, you, make choices to minimize your risk and to slow the transmission, but also obviously to respond to some of those employer mandates. So if you're a family and you want your child or you're a teacher and you need access to testing as part of your employment, this free testing is available along with clinics that we've administered and set up around Dutchess County over the course of the last several months. If you're going off on a vacation or you're taking a trip or you're getting together with family and you want to, for peace of mind, a test to be sure, this testing is available to you. And again, we have been focused on this because it gives us information, and information is key to making important choices, both for you and then from a policy perspective. And that's why widespread testing being available is important and necessary, and it's something that by choice, and again, some are mandated by their employer, but others simply choose for, again, peace of mind or assurance as they make choices, you make choices to go out and do, engage in certain activities. Having that test provide you, having the opportunity to get that test allows you to make those decisions. And from our perspective, we think that this is important, and it's something our health department has been engaged in very aggressively for several months now. We'll advise you that because of volume, and I'll also say workforce issues all across the country, test results are taking as long as 72 hours. So the average wait for test results is 72 hours. It is the reality of both volume and then also the fact that there are workforce issues in every layer of employment, and this is one of them. And so ProPhase Labs tries to process these as quickly as possible, but it's a 72-hour average. Now, you likely know that there is an opportunity for counties like ours to distribute over-the-counter test kits. Dutchess County is doing this along with other counties across the state. Ulster County had an experience that we're grateful we can learn from. Access to over-the-counter tests is very limited. So getting 10,000 tests to distribute to 295,000 people, yes, will result in a lot of people being very agitated and frustrated and angry. And we've experienced this. If you remember when we went through vaccine rollout, when the state sort of fumbled vaccine and vaccinations early on, you had to wait online, you had to wait in line, you didn't necessarily know when you were going to have access. Imagine the same respect, that same crush of people trying to access a even smaller number of tests. And so from our perspective, getting tests that are paid for by taxpayers, whether they be American taxpayers or New York taxpayers, all of us being one of those, we want to be sure that there is a fair distribution, and most importantly, that we don't create some chaotic situation. So Dutchess County was awarded approximately 10,000 test kits, over-the-counter test kits. We received them on Friday or Saturday of this last weekend, same as most other counties in the state. We are working with towns, villages, and cities. I've informed supervisors and mayors in every municipality in the county that our expectation is that we will allot every time we get an allotment of over-the-counter test kits, we are going to disperse them based on population to their municipality. That municipality will establish the point of collection. That municipality will also require residency. So if you are a resident of the village of Tivoli, you would go to wherever Tivoli identifies in the village as their point of contact to access and get one of these test kits. If you're a resident of the town of Red Hook but not in Tivoli, you would go to the town of Red Hook designated location. Municipalities were asked today to provide us those locations where they will engage in distribution. We are going to tell you up front there is not enough for you to want for everyone to get one. So please be patient with the municipality, be patient with the clerk or the employee or the volunteer who's participating in the distribution. But just as a reference, if we have 10,000 kits, the residents of Tivoli, I think, get 20 or 25. And so as these allotments come our way, we will distribute them using those logistics, that infrastructure. Towns, villages, and cities, they'll identify their points of distribution. We've asked that they include outside ordinary office hours for distribution times as well. Once they establish that, each municipality will be responsible for working with you to get you access to those over-the-counter tests. Useful for peace of mind. Additionally, one of the things that we want to be concerned about is, what do you do with the test results, right? You have an over-the-counter test. That is not a test. That's not the same as a PCR test or something you're going to get at the health department through the clinics, which means, how do you record this information if you want it reported? How do you use it either to ensure that you're not required to quarantine or that you are required to quarantine? So all of that has to be worked out as part of distribution, but we recognize, and our public health officials recognize, certainly the value of having access to testing. Now, we're focused on that. We're working with those municipalities, and over the course of the next several days, you'll start hearing more about that. Secondly, Dutchess County led the state in test to stay for school students. We have been focused, and I have said this many times, we cannot repeat the mistakes that were made in the past and abandon our responsibility to educate kids in a school setting. Yes, we have to take precautionary measures. Yes, there needs to be safety, but we cannot allow the trauma of taking our kids out of a school setting or the regression that will will come from it, and it will. There is little question that our kids have lost a lot of time, a lot of opportunity, and yes, educational advancement, and that cannot be repeated. So our focus has been for those who choose, so always voluntary, no one's mandating you do this, but we had been providing test kits and testing opportunities to every school district that wants to participate in the Test to Stay model. Wappinger Central being one of them, Pine Plains being another. Most of our school districts have accepted this as a model. And so if you have an individual student that's a contact to a positive case, you, the parent, can choose to have that child tested regularly to ensure negative, and they can remain in school. Again, optional, it's your choice, but it's an opportunity that helps us, under the current protocols established by the State Education Department and others, keep kids in a classroom, teachers and faculty safer. We have been leading the way on this for several months now. On Friday, when the CDC announced that they had studied Test to Stay as a model, they emphatically supported it. The state of New York did not. The state did not embrace Test to Stay. In fact, they wouldn't let us use test kits that they distributed for Test to Stay. We think it was necessary. States across the country were using it. We implemented it, and we've seen it work. And that's important. So last week, when the CDC emphatically endorsed Test to Stay as a model for keeping kids in school, I sent a letter to Governor Hochul encouraging the state to embrace Test to Stay as a model. Again, it's optional, it's your choice, but it is an option for people to be able to use. And yesterday, you may have learned and know that Governor Hochul has now embraced the Test to Stay as a model and is providing test kits to schools all across the state of New York. Those tests will come to the county, like ours, Department of Emergency Response. We will distribute them to schools, and again, by choice, you can choose to participate or not, but at the end of the day, it gives you an option that will help us keep kids in school while we have to transition to treatment therapies and helping people get access to the healthcare that they need to overcome the virus. And there are promising therapies that have been underway across the country and across the globe. Some a pill in Great Britain's been approved for use, kind of like the Theraflu model. There is the injection of the antibodies that is occurring in other parts of the state and other parts of the country. So we are also, as a public health entity, focused on that too. Dr. Olivia Santiago Rosado began her service yesterday as Dutchess County's new Commissioner of Health. We welcome her, thrilled to have her joining the team and leading our public health efforts. And she has been already engaged with the healthcare community, and she is taking an aggressive role in our testing access and the treatment modalities effort, this thing that we've talked about, antibody infusion, etc. Dr. Santiago has sent a letter to Dr. Bassett, the Commissioner of the New York State Department of Health, today, calling for widespread access to antibody infusion. There are parts of the state that have broader access. There are physicians and hospital centers that have access. It is very limited locally. We believe that statewide there needs to be a network of access. If you test positive and you have symptoms, there must be an aggressive way to ensure people have access to health care. This is one of the things that can happen. I think that America should be focused on Operation Warp Speed for treatment therapies and response to testing positive, and instead we find the country catching sort of, always a little bit behind the next stage, the next wave. Right now, that's something that we think, certainly I think that the country should be engaged in. Dr. Santiago has asked the state to take use of the resources we have, encourage its widespread use, so that at least for those who would benefit from it would have access to the antibody infusion. We're going to be focusing a lot on that as well. So, surveillance testing, encouraging you to take those appropriate mitigation steps that we've all talked about, and yes, we all talk about them. We encourage you to have the questions, answers to your questions regarding vaccination, and choose to be vaccinated. There are opportunities for you to do that. We do want you to monitor your own health, including monitoring your own personal hygiene. If you have symptoms, we certainly want you not to engage in community activities. Try to isolate yourself so that you're protecting your health and the health of others. Get the treatment. Reach out to your physicians to see if you have access to therapy and treatment. And of course, yes, we encourage you to wear a mask. I was asked today, do we encourage mask wearing? Yes, we do, but we don't encourage fining businesses $1,000 a pop, and that's not something that we're going to do. And so, we accept the calls, we accept the questions. Very grateful to listen to Dutchess County residents, no matter how happy or unhappy you might be. Our focus is on encouraging people to make the choices in their lives to be safer, to do what government can do, which is the testing, vaccination, and treatment. And we want you to monitor your own health and to make and choose to take steps to protect your health and the health of those around you. And so with that, we encourage you as you get close to the Christmas holiday and start the New Year holiday as well. Most importantly, if you're not feeling well, please stay in. And if you have a degree of vulnerability, then make those decisions, those choices that will benefit you. And that may include not going to a social event or family activity. It may include wearing a mask. It may include being somewhat physically distant during a family or a community activity. But we want you to be safe and stay healthy. And most importantly, this time of year, we encourage you to be kind to each other. On behalf of the residents of Dutchess County, all of the residents for whom I work, to all of you, Merry Christmas, and here's to a happy and healthier New Year.